Good morning. I'm really grateful to be here and to have an opportunity to speak at this conference. When I walked in the door, I was kind of overwhelmed by just the number of people who I view attending a meeting such as this as information seeking. And in my practice, and I think it's pretty common that one of the ways in which people cope with chronic illness is to gather information. And so I applaud you for being here. A couple announcements or disclaimers. One is that the bulk of my experience has been in caring for people whose lives have been impacted by cancer. Over the past 25 years, I've worked with a supportive and palliative care team. Our team is a physician, an advanced practice nurse, social worker, nutritionist, chaplain, counselor. Certainly we are quick to refer people to PT, OT, speech, whatever the needs are. I currently work in a clinic at the university. This medical specialty, supportive and palliative care, focuses on helping people, both patients and their caregivers, to live as well as they can, regardless of their diagnosis or prognosis. Clearly, the person with medical illness X is the focus of our care, but it's not exclusive. The caregiver is equally as important. Certainly, diseases are different. They have different trajectories. They have different symptom burdens. Yet in my review of the literature and in having conversations with people living with Parkinson's disease, I recognize that there are common themes in the lives of caregivers. None perfectly mirror another's, but there are sufficient similarities to merit inclusion in our discussion today. Each of you as caregivers are on a highway. Some are on exits, an on-ramp, an overpass, some in the slow lane, some in the fast lane. Some are pulled over on the shoulder at a rest stop. Clearly, the intensity or current applicability to what I have to say this morning will depend upon where you are on that highway. I'd like to first talk about the significance of unpaid caregivers in our country. This was a study that was done in order to present a portrait of unpaid family caregivers. To that end, the National Alliance of Caregiving and the AARP Public Policy Institute conducted research and presented their findings in this report. This report includes about 1,300 online interviews with caregivers who were caring for adults. And I want to share with you some of their experience. It's estimated that 39.8 million U.S. adults provide unpaid care to an adult. That's a lot of money. 85% provide care to a relative of those caregivers. 50% of them are providing care to a parent or a parent-in-law. About 10% of the population is estimated as caring for a spouse. One of the take-homes for me in this report is how there is a higher hour caregiver rate among, at least it's 4 times as much as for people who are caring for spouses. And I think the reason for that is that 78% of spouse caregivers are the sole unpaid provider. I just wonder how many of you that applies to. Another take-home for me as a provider is that only 14% of those who were surveyed said that they felt prepared for the job that they were being asked to do. So to me, it's about asking the question in the clinic with that dyad of patient and caregiver, do you feel prepared for what you've been asked to do? What's most difficult? Do you have what you think you need? Do you think you need an extra set of hands? Is this something you think you can do? The report speaks to the emotional distress of caregivers, which increases in relationship to the burden of care, care duration, lack of choice in caregiving role, and cognitive impairment. 53% of those people who are in a spousal relationship stated that they had no long-term plans, like handling financial matters, healthcare decisions, living arrangements. And I think it speaks to the importance of developing contingency plans, a plan A, a plan B, for the earlier, and the earlier the better. Getting this accomplished early with intermittent review helps with the feeling that we do have some control in an illness of an unpredictable trajectory. So what I'd like to do is to speak about the lived experience of being a caregiver. I think often neglected and maybe perceived as being taboo is a conversation about the burden of being the caregiver, grief, the unpredictability, loneliness, and isolation. It may sound like Debbie Downer, but I think it's important that we put it out there on the table about what it means to be a caregiver. I want to spend some time also talking about identifying and tapping into strengths and the importance of self-care. Caregiver burden refers to a realm of physical, mental, and social economical challenges experienced by the caregiver. Burden may seem like a pejorative term. I tell you, I hear all the time in caring for people with serious illness about their fear about being a burden on their loved one. The truth is, being a caregiver is and can be burdensome. It's not about blame, it's not about shame, it's not about being unwilling, but it's just about truth-telling. And also, I think it's important that we be mindful of what about the experience is burdensome so that we can help target interventions. So maybe this is a bit of a risk, but in your packet I've included the Zaret Burden Index. And this is a clinical tool. It's also used in research to try to quantify the experience of being a caregiver. What it does is these questions actually help give voice to the experience, identifying strengths as well as where help is needed. This tool is used to try to identify how to be most helpful. So you're asked on a scale of 0 to 4 to respond to these questions, and you can do this in private, you can do it just in your head, you can do finger math, but these are the questions to help elicit the intensity of the caregiver burden. Do you feel that because of the time you spend with your relative that you don't have enough time for yourself? Do you feel stressed between caring for your relative and trying to meet other responsibilities on a 0 to 4 scale? Do you feel angry when you're around your relative? Next question. Do you feel that your relative currently affects your relationship with family members and friends in a negative way? Do you feel strained when you're around your relative? Do you feel that your health has suffered because of your involvement with your relative? Next question. Do you feel that you don't have as much privacy as you would like because of your relative? Do you feel that your social life has suffered because you're caring for a relative? Do you feel that you have lost control of your life since your relative's illness? Do you feel uncertain about what to do about your relative? Do you feel you should be doing more for your relative? Do you feel you could do a better job in caring for your relative? This clearly is not a diagnostic tool. It's an estimate of the strain and stress that can be associated with being a caregiver. Clearly, it does not equate with caregivers being selfish, unloving, uncaring, but it's an appraisal. And for some, it may be a call to action, depending upon your score. I want to talk about a neglected topic, and that is grief. There is no denying that illness is associated with multiple losses, visible and invisible. Caregivers may experience many kinds of losses. Loss of independence, loss of control, loss of the future as it had been imagined, loss of financial security, loss of a relationship as it once was, loss of freedom, loss of sleep, loss of someone to share chores with and other tasks, or simply the loss of someone to talk things over with. People with chronic illness clearly experience many of these same losses. I think it's very easy to ignore these losses and just keep doing the same things that need to be done. However, these losses can lead to grief, and grief can lead to sadness and depression and anger and guilt and sleeplessness and other physical and emotional problems. It is important to identify our losses, identify the feelings associated with it, and to let ourselves grieve the changes that have happened in our lives. So let's talk a bit more about how to put your arms around what it is that you feel you've lost or that's changed. The truth is that all of us have negotiated loss in our life. We may not be aware of how we move through it, but each loss lays a foundation for negotiating a new loss. One of the ways to grieve and then move on is to name it. To name it by asking, what is it that I've lost as a consequence of Parkinson's disease? It could be your career, your free time, travel, a friend, whatever comes to mind, my freedom, spontaneity, my space, the life I once knew, my patience. One strategy is, in naming those losses, is to write them down. Then we can do something with them. But as you write them down, I encourage you to be mindful of what the feeling is that you're experiencing. And give it space. Once the loss, and again, this is not a fait accompli, it is something that we all work on. It's about life and living, of being able to claim, name the loss that we've experienced. One of the strategies that we talk about is to ritualize the loss. Think about the rituals associated with death. There is an obituary, there is a visitation, a funeral, a memorial service, a wake, a celebration of life, wearing black, not wearing black, letting balloons go. There is ritual around that. So how do we ritualize the losses that you've named? I think ritualizing us forces action and doing, so that grieving is not just in the mind and in the heart, but there's some ritual to it. So for instance, if you've written down those things that you feel you've lost, to put them in a box, and then over time, take it out, look at it, write about it, illustrate it, sing about it, scream about it. I think one very tangible thing is, and it may sound like voodoo, but if you've ever done it, is in a fire, to let that slip of paper be in the fire and to claim that you've released that loss. Another is, now that you've named it and ritualized it, is to ask yourself, what would I like to change? What do I yearn for? Maybe write down 5 or 10 things, to make a list. And as you make that list, like when you named it, begin to feel what it's like to put down those things that you want to change or that you yearn to recapture or modify. But to be with those feelings and just be there with them. I suggest then that you share your experience with people who care about you, your partner. Share it in a support group. I just celebrate your access to very vibrant caregiver support groups in this community. Perhaps seeking out the help of a counselor Let me just say that in my experience, it takes a lot of energy to hold back from acknowledging loss and grieving loss. It takes a lot of energy to hold it in. My hope is that by doing this work, the energy that's being used to hold back the intensity of the feeling of loss or grief will be freed up to allow you to heal and move forward. Another piece of the lived experience with chronic illness is striving to live with unpredictability and ambiguity. Learning to walk, I think of it as learning to walk through the fog. We like control. We like a linear course, A to B to C to D, something that's predictable, and wanting at all times to avoid a more meandrous, a more ambiguous course. So I'd like to give you some suggestions about, and this room is probably filled with wonderful suggestions about how to deal with grief, loss, ambiguity, unpredictability, but I'll just offer a few. One is creating a routine. I think that maintaining family ritual can be very important in trying. That's a predictable event. This family always celebrates a birthday with an Italian cheesecake, and we are not Italian cream cake, or if you want to do cheesecake, that's okay, but Italian cream cake. My family always sings, Mary has a birthday, we're so glad, we will see how many she. That is part of the ritual. And maintaining those rituals, I think, can help aid in predictability. Think incrementally. Not, I'm going to re-landscape my yard, but rather, how can I tart up the front porch for Halloween? Gather information. Again, you all are gatherers. The fact that you're here, you're a gatherer. But gathering information about Parkinson's disease, its treatment, kind of what to expect, what do I need to look for, gathering information about community resources, in-home daycare respite options, having someone help you evaluate your home setup for in-home safety, a financial planner. You probably already do this to prep for the appointments with your care providers. And I can tell you from the perspective of somebody who's a caregiver, having a patient and a family member come in with a list, their notes, increases the likelihood that their agenda, not mine, will set the tone for that clinic appointment visit. It speaks volumes when you come in with your paper. I would suggest that each of you, it's a joint venture, when you're presenting yourself to the physician, whether you go alone or not, but is that you come prepared with what are the top 3 concerns I want to address in this meeting. It will serve you well to speak right away about what it is that you want to accomplish as a consequence of your clinic visit. There are a number of things that you might include in prepping for that all-important clinic visit. Next slide. I think another consideration in strategies to increase predictability and decrease ambiguity is to ask questions about, what do I do when he falls? What do I do when he chokes? What do I do when he becomes confused or agitated? What if he needs CPR? Is that a route that we want to go? Planning for what happens if something happens to me, temporarily or permanently. What will the plan of care be? I am a big advocate of early and ongoing conversations about goals of care. Discussion about plan A, plan B, plan C in terms of Parkinson's treatment. And I often coach people and say, when you're with Dr. X, some of the questions you might want to ask is, based upon what you know about me and my family, what do we need to plan for in the next 3 months, 6 months, 12 years, 2 years, 5 years? of course, you're not going to cover all of this in the same clinic appointment, but it's helped me, and given the unpredictability of the illness, let's break it up into short intervals. What to expect in 3 months, 6 months, 12 months? How do you see our life is going to change? What do we need to plan for? I think another lived experience in chronic illness is a sense of isolation and loneliness. You know, I think it's human nature that at the time of diagnosis, people rush in. Concerned people rushed in, and then they taper off. They forget, unless we help remind them. In a conversation with someone who is a caregiver to a gentleman with Parkinson's disease, she said to me, I get 4 hours to play and I don't have anyone to play with. I don't know what to do with myself. Have you ever experienced that? Clearly, part of that isolation and loneliness can stem from just the dynamic or the change in the communication pattern between the caregiver and the care recipient. You know, a decrease in voice volume, a change in facial expression, that influences our both verbal and nonverbal communication as a couple or as a partner. The relationship dynamic changes with decreased reciprocal attention and affection just by virtue of the illness. One of the things that has been startling to me is how in our daily practice as providers, we fail to really focus in on the individual needs of the caregiver. And I think this quote that came from an interview is very telling. The fact that someone actually took the time, because I was not the patient, made me feel valued. It made me feel like all of a sudden someone saw me in my struggle. In reviewing the literature, there are a number of research studies that suggest that non-motor symptoms have a greater impact on caregivers than motor symptoms. Non-motor symptoms like problems with concentration, attention span, verbal fluency, depression, anxiety, dementia, personality changes, all of those things were more difficult than gait or balance symptoms. And what we know is that when there's an increase in non-motor symptoms, there is an increase in change in the role of the caregiver. I think at that time it would be very likely that the world for the caregiver becomes increasingly narrowed. You become the chaperone. I heard the story of and it really spoke to me about the isolation and that loneliness that can come when you're a caregiver. She talked about going to a restaurant. Part of the mapping out the activity was, where's the bathroom? Where can we sit where there's minimal noise? How do our friends adjust to the change in his behavior? His slowness to respond? His ability to handle a fork? Choking? And I think as a consequence of those challenges, there's less social interaction. Isolation and loneliness, as well as caregiver burden, are ripe for the potential for depression and anxiety. Everybody can express or have the experience of depression in different ways. These are the classic symptoms typically associated or described as sadness and hopelessness. Others may have signs that might not equate with depression, such as, or they think doesn't equate with depression, but may include extreme fatigue or irritability. But what I think is most important is to pay attention to where you are. And if being depressed or being anxious are a phenomenon that you believe that you're dealing with, is to bring that to people's attention. Next slide. I absolutely believe and I say this to people all the time, I know we're working on making sure we're going to pay very close attention to your body, but I want to pay equal attention to your spirit. And that it not only applies to the person who's there with an illness, but also to the caregiver, because you're pivotal. I think depression deserves the same attention as diabetes and high blood pressure. It's not uncommon, and typically it's a combination of perhaps a short-term use of an antidepressant, as well as getting into a counseling relationship. I often will ask the caregiver that's in the room with me, when was the last time you saw your primary care doctor? Do you have one? Who's paying attention to your physical and mental health? So let me just mention a few things about what have been shown to be protective factors in this vital role of being a caregiver. The degree of social support is critically important. People who tend to be optimistic, have a sense of meaning in one's life, who feel confident, I can do this, seem to be more tolerant of the stress and strain of being a caregiver, having good mental and physical health. Clearly, the quality of the relationship kind of going into all of this. And preparedness serves as a buffer to the strain and stress of being a caregiver. Again, here you are, working on your preparedness. I also think it's important to take stock in your signature strengths. I think it's important to episodically look at this list and say to yourself, those are attributes that describe me. I suggest you look at this list, circle 5 of them, write them down on a 3x5 card, put it in a plastic picture frame that that has an easel that you can sit by your bedside or wherever on your desk, as a way of reminding yourself that you have strengths, have gotten you to where you are right now, and when you're feeling particularly vulnerable, to be ever so much more mindful of what it is that you bring to the caregiving role. And my assumption is it's a lot. Sherry Woldbridge is a woman who had early onset, or has early onset Parkinson's disease, and she writes in a newsletter, she writes a column in the Parkinson's News Today, and she offers 8 things caregivers need. And so I'll give you this list. It seems so simple, but yet it's so hard. To simply breathe deeply. And when you get that 1 free minute, do something that puts a smile on your face. As I drove over here today, I listened to Click and Clack on NPR. I always laugh when I listen to, and if I'd been here long, if I had delayed coming long enough, I would have been listening to Wait, Wait, Don't Tell Me. I need to laugh. So how do you program in to your routine opportunities to laugh? Is there a particular movie? Another thing that she suggests is don't focus on the what ifs. Focus on the now. Although that's not to diminish my encouragement to have your contingency plans in place and to plan for the future. She said, get yourself a sense of humor. Get yourself a support group. She reminds us that we all need friends. She says, don't alienate them by thinking you can do this by yourself. Accept their invitations to help. Accept an hour off. Someone coming over and asking and offering to wash the dishes, to pick up some groceries, to drop the kids off at practice, or cooking your family a meal. She says, give yourself some slack and let your friends feel needed, because they are offering to help before you even have asked. If they do that, they actually may be seeing a need that you don't. She says, think ahead, a daily schedule, and don't beat yourself up. There'll be good days and bad days, and I oftentimes will talk with people about who are you going to have sitting on your shoulder? The one that is whispering loving, affirming thoughts in your ear, or the one who's saying, you're not doing it good enough, you're not doing enough, you're not doing, to knock that one off your shoulder and to allow the one that's whispering loving, affirming messages to you as a caregiver. I'm doing a really good job. I did the best that I could. Tomorrow will be a better day. Today was a great day. You really handled that well. Are all ways in which to sustain yourself. And so some final things about self-care. I'm going to give you this list. You don't have to do them all. Forgive yourself for not being perfect. Give yourself permission to feel emotionally off-balanced at times. Determine your limits. Build in breaks and make breaks a priority. Be kind to yourself. Seek joy in your relationship with your care recipient. Develop a routine of enjoying each other outside of the caregiver role. Husband, wife, mom, daughter, brother, sister. Let go of what was and focus on what's now. Take stock in caregiver rewards, the rewards of connection, of relationship, in growth, in recognizing your strength, taking pleasure in giving, seeing positives, feeling purposeful. Get some rest, eat properly. Exercise. Be intentional about being with people who lift you up. So in conclusion, caregiving is hard work. It's meaningful work. Caregiver requires attention to yourself, acknowledging loss, sorting out where control can be obtained in an unpredictable illness, striving to remain engaged, doing a self-inventory of how am I doing, and then asking for what it is that you need. Again, taking stock in your strength, investing some capital in your own self-care. I can tell you, in my years of partnering with people who have been impacted by serious chronic illness, every day I witness the strength of the human spirit. It's part of what sustains me in the work that I do. The strength of the human spirit. And so I'll close with this. If we could look into each other's hearts and understand the unique challenges each of us face, I think we would treat each other much more gently, with more love, patience, tolerance, and care. Thank you very much.